Hello all, welcome to our podcast The Prescription on Earshot Media. I'm your host Dr. Karan Thakur. Hope you're all safe and sound. From our entire team here, we wish you a very happy Diwali guys. Diwali brings light and prosperity, but there's a dark side to the festival as well. Because with it, it also brings a lot of noise and air pollution. It's not news to any of us that the air quality index during these 3 to 4 days shoots up. The firecrackers emitting harmful smoke also cause noise and air pollution. From an 80-year-old to an 8-year-old, it is this dense smoke suspended in the air that we inhale, and to our detriment. Delhi records the worst AQI during this time. Last year, when the country was under a lockdown, there came a time when the air quality was as good as Europe. But then came Diwali and dragged down the air quality, raising more concerns given the pandemic at that time. To discuss the issue of air pollution, poor air quality, and its impact on our health, I'm joined today by Dr. Nikhil Modi, Senior Consultant Respiratory Medicine and Critical Care at Indraprastha Apollo Hospitals, New Delhi.
Indraprastha Apollo Hospitals presents The Prescription in association with Earshot.in.
Hello, Dr. Modi. Welcome to our podcast.
Thanks, Dr. Karan. It's my pleasure to be here.
So let's dive straight into the subject of air quality, air pollution, and the impact on our lungs and health. Dr. Modi, why is poor air quality, let's say, so bad or harmful to our lungs?
Karan, coming on to the air quality, it is one thing, the air is one thing which we are always breathing in. Every minute, 12 to 14 times we are taking in this air for the search of oxygen in our body. And once we have to breathe this air, and if it is poor, it has multiple pollutants which are ppm 2.5 and other harmful gases. So once we inhale them, so these are so small, they can enter the lungs, deep inside the lungs, they can cause damage. Even through the lungs, they can filter out into the blood and cause multiple problems even to other organs. So it's not just the lungs which are getting damaged due to that, but also other organs. So that's why the worry is so much.
And then specifically to Diwali, why is it that Diwali becomes such a concern or the winter months become such a concern?
In winter, what happens? The air is cold. So it tends to stay for a long, the fog thing which is there. So the air, also the air wind velocity is reduced during this time. So the air tends to stay there. So if the firecrackers are burned, even we talk about Prali most of the time. So
This
even
is
if that
stubble
is burned,
burning
the
that
stubble
is-
burning
right.
which we talk about. So if it is that, then due to this, as the air is not moving fast, the wind velocity is slow. So this air tends to stay more at the lower level, and we tend to inhale this more and more, and that's why we are getting exposed to that even at a very high level. So all the problems are found to be more, even your asthma episodes are more. Also the air quality which shoots up to very high levels, so the damage which is there is too high, as well as the infection rate becomes too high.
There are multiple respiratory illnesses that can impact the health of our lungs and our overall well-being. These include asthma, chronic obstructive pulmonary disease, also called COPD, pulmonary fibrosis, pneumonia, and even lung cancer. So, Dr. Nikhil, you touched upon asthma. I think it's the most cited and most well-known of lung diseases, let's say. My first question is, how prevalent is it? And at what age category do you usually see it?
Asthma, actually, when initially that thing came, it was always talked about it is an allergy, the allergic reaction to pollens which are in the air, allergic to anything your genetic makeup has make you prone to allergy. So when you inhale that, there is a bronchoconstriction, the windpipes get narrowed, and the congestion which is produced, there is mucus trapping, and you feel difficult to breathe out, there is cough, and breathing difficulties are the main symptoms. But now with the increase in the pollution levels, what we are seeing, even in persons who usually never had a genetic tendency, they are showing similar symptoms as we see in asthma. Previously, we used to say asthma was a childhood disease. The allergy used to manifest in early age, but now late onset asthma is also increasing, as well as the asthma which was intermittent in nature, episodic whenever the pollen's exposure was there, it has now been there throughout the year. And even a study says asthma used to be there in 1 in every 5 child. Now it has increased to 1 in every 3rd child. So the prevalence is increasing as well as it is staying. Further, the air pollution, it is equivalent to smoking cigarettes. So the COPD thing which you talked about, chronic obstructive pulmonary disease, even the asthmatics now having permanent lung damage, which we never used to see in past, and this permanent damage leads to permanent airway changes, which leads to COPD. That is, the obstruction will be there permanently. Even if you take treatment, it will be a progressive disease, and that's why your life expectancy goes down, your quality of life goes down, and you have to be dependent on breathing medicines for a longer time.
So before we get into COPD, which is obviously a very severe condition, you mentioned that asthma now you see in children from the rates of 1 in 5 to 1 in 3. But there's also a belief that this is congenital. But what I'm hearing is that this can also develop over time. You need not be born with it.
Yeah. You may not be born with it, and the changes which are now happening due to pollution. So asthma we are seeing even in patients who never had a family history, because in genetic thing which we used to see, family history of any type of allergy used to be there, but now a person without any family history are also having similar symptoms, and it is increasing day by day.
Even in adults?
Even in adults.
So you can actually get asthma for the first time as an adult?
Yes. Late onset asthma, which we call, it was a rare entity in the past. Now we are seeing many cases with that.
COPD is said to be the second highest cause of death in India after heart disease in 2017. This data was published in The Lancet. The study stated that almost 1 million Indians lost their lives to COPD. So, Dr. Nikhil, you touched upon what COPD is. What are the symptoms of COPD?
COPD, as the full form suggests, it's a chronic, that means a long staying, obstructive, leading to obstruction of the airways, pulmonary related to lung disease. So once due to it, initially it was always due to smoking. So a person who is a smoker for a significant time, we used to say once he develops symptom, he has COPD. Now, in some cases, air quality goes down so much that you breathe in air for a day, it is equivalent to smoking 20 cigarettes a day. So now we are seeing more and more COPD in non-smokers as well. So as your airways gets remodeled, so due to the obstruction, you feel breathless. Breathlessness is the most common symptom, which initially comes when you are walking or climbing stairs, that is on exertion. But later, as it progresses, even on rest, you feel breathless. Further, there is change in mucus secreting glands in the airways, due to which there is excessive mucus production. So you always have cough, tendency to clear out thick, yellow or dirty colored sputum. So these are the most common symptoms of that. And in these mucus trapping, once it is there, so you can get secondary infections. So recurrent pneumonias are a very common finding which we see.
So COPD cannot be congenital, it develops over time.
It is a condition which is acquired, and it is due to the damage which we have in the lungs due to either smoking or due to the exposure to this air pollution.
So environmental reasons are one big problem.
Yes.
And how is it different from asthma?
In asthma, it is being an allergy. So we have many medicines which are available which can control the allergy, and the ways bronchoconstriction, that is the airways which become narrow, are reversible. That is, if you take medicine, the airways will become normal. But once COPD sets in, the damage is permanent. Even if you continue to take the medicines, it will not reverse back and it will continue to progress. So most of the medicines are able to control it but not cure it.
So there is no cure for COPD, but the situation is managed with some drugs and medicines and interventions.
Absolutely.
And asthma, otherwise, as you said, is reversible, but we have to use or carry the inhalers.
Yes.
Right. And does India have enough diagnostic and treatment facilities for COPD?
To be very frank, respiratory illness, I think, now are upcoming. Maybe COVID has helped to recognize them more. Uh, Most of the states and smaller cities even don't have a single respiratory therapist available. So they continue to linger on, and once they reach a state that it is an irreversible damage and the things have gone too far, then they travel to bigger states and then they get diagnosed. So we need to increase the education to the person in smaller cities, smaller towns, so that they identify these problems, and then so that they can reach a proper doctor on time. And obviously facilities are there, but people are not reaching there on time to avail these facilities.
We had an interesting discussion on breast cancer 2 episodes back, and there again I was joined by Dr. Sarika Gupta, and she was mentioning the same thing, that one big problem that she sees is that if people report earlier, there is more things that you can do for the patient. And I'm hearing that that's the same is pretty much true for respiratory illnesses as well.
Definitely. Even if in asthma, if the proper treatment is not initiated on time, the damage becomes irreversible. Even asthma can progress to irreversibility, and then there is no hope left. So earlier the diagnosis is made, earlier the treatment initiated, better for the patient.
So you mentioned two factors. One is congenital in terms of genetic factors for asthma. The other is your own habits such as smoking for COPD. How does air pollution fit into this in causing respiratory illnesses?
Air pollution has a major role in aggravating all these factors. The COPD, now air pollution is identified as an independent cause. Apart from smoking, even if you are exposed to air pollution, you still can have COPD.
Okay.
Asthma, most of the time, it is an aggravating factor. That is, your asthma symptoms will aggravate due to that, and your disease progression can be faster. Severity of asthma can increase. Apart from that, air pollution also makes us prone to infections also, which we should not forget. Even we talk about viral, the COVID thing, the other influenza thing, or even pneumonias, the bacterial pneumonias, and tuberculosis. Our country, tuberculosis is a very grave problem, so we should not be taking that out. And due to there is a ciliary mechanism, that there is a mechanism which clears out all the waste and the bacteria from our lungs. As soon as we are exposed to air pollution, this ciliary mechanism is damaged. So these waste, these bacteria tends to stay more inside our lungs, and all these infections become a problem. And obviously the lung cancer. Lung cancer, we used to see almost 80% lung cancer due to smoking.
Right.
And now more and more lung cancer are seen in non-smokers, as well as in early age group. This is due to air pollution.
That's a startling statistic you mentioned. Some numbers may put things in perspective. In India, chronic respiratory diseases were responsible for 10.9, nearly 11% of the total deaths in 2016. India has 18% of the world's population, but 32% of the global burden of respiratory diseases. This was published in a study by the Lancet Global Health in 2019. As it turns out, pollution was the biggest contributor to respiratory disease burden. About 33.6% of COPD could be attributed to ambient air pollution, 26% to household air pollution, and 21% to smoking. So, Dr. Nikhil, we've seen these statistics, and obviously, as you mentioned, air pollution is now becoming the leading factor for respiratory illnesses. But how are children impacted by air pollution? Is it more because obviously they won't be smokers, they may not have congenital illnesses that cause asthma and other conditions, but how does air pollution affect children?
Air pollution actually is more harmful to our children, because already the amount of air pollution which we are exposing them to, the studies are showing that the life expectancy has reduced by 6 to 7 years. Already for our children, we have taken 6 to 7 years out of their life.
Just because of air pollution?
Just because of air pollution. Wow. This is an average thing for all the population. And if these levels are not taken care right now, this life expectancy is bound to come down more. Cases are there in which in 25 to 30-year-old guy are coming to us with lung cancer, which never used to happen. We never used to see any lung cancer below 50 years of age. So the life expectancy is already gone. So for children, we need to take these measures to control this air pollution right now. Otherwise, we are just putting them into a hell only.
And is this a winter phenomena? I mean, there's a lot of discussion that one hears during winters that, how this impacts children. But would you say that actually the concern is all year round?
It is all year round. It is only that due to the fog and the smog, it becomes more visible. Definitely due to the wind velocity decreasing, the levels are poorer. But if you see throughout the year, if you take example of Delhi, the air quality is in severe category all the
Most
year
of the
round. So we should not be focusing only on this 1 month or this Diwali. This should be a concern throughout the year, and we should be talking about it throughout the year.
One would have thought that the coronavirus pandemic last year may have posed as a deterrent to burn firecrackers during Diwali. But it was alarming to witness the contrary. The Delhi government went on to express its worry over this. Poor quality of air that we breathe is a major risk factor for acute and chronic respiratory diseases and cardiovascular diseases. Now combine that with the risk of COVID-19 and the gravity of the situation increases by leaps and bounds. Dr. Nikhil, you've treated multiple patients of COVID during the first wave, during the second wave, and now we've got the air pollution and the air quality going down. So what is it that you're recommending to your patients whom you treated for COVID to better prepare for this onset of poor air quality?
There are two aspects to it. There is still COVID around us. So there are still a group of population which is prone to get fresh COVID.
Right.
So for them, if you are being exposed to air pollution, your lungs are weak, the chances of getting a severe COVID is much, much higher. So mask is going to protect you. Try to take small steps from your side to reduce the air pollution, because each and every individual has the responsibility towards it. Further, the patient who have recovered from COVID, so those are post-COVID, especially those who develop moderate to severe disease, had a fall in oxygen, required hospitalization. So their lungs are still very, very weak. And it is being said, if the variant has changed after 3 to 6 months time, you can still get a fresh COVID. Also, once you are exposed to this changing air pollution, symptoms of bronchitis, your weakened lungs getting a fresh pneumonia, your weakened lungs having breathing difficulty, and again your oxygen levels going down are much, much higher. So for COVID, people have started to wear masks at least, and we have been recommending masks once you go out for air pollution, I think for last 10 years.
But nobody
has taken care. But now, since you have developed a habit of wearing a mask, so to protect yourself from air pollution also, I would recommend whenever you are going out, you should be wearing a mask.
And do you see Indians more predisposed to respiratory diseases, or is it now seen across the board?
It is across the board. Only thing is the level of air quality, the severity of air quality which we see in Indian cities. Even if you go by the global standards, most of the countries in top 100 which have a poor air quality, most of the countries are from India.
True.
So that makes us more vulnerable to this air pollution. So that's why we need to take some steps to
The 2019 study that I referred to, the Lancet study, it also spoke about air pollution causing lower respiratory tract infections. Could you tell our listeners what is a lower tract in
basically
respiratory infection?
if we start breathing from the nose. So nose, the mouth, the throat forms our upper respiratory tract. The windpipes in the chest, and through that into the lungs forms the lower respiratory tract. Even the COPD and asthma involves the lower respiratory tract. That's why the breathing difficulty is more. And once we talk about pneumonia, it is the most last part of the lungs where the gas exchange is occurring. So once the ciliary mechanism which I was talking is not able to clear out these bacteria, they go deep into our lungs. Damage is caused deep into our lungs, and these infections which we talk about are the lower respiratory tract infections.
In this section, I would like to ask Dr. Nikhil about management strategies against air pollution. So, Dr. Nikhil, we've discussed the problem, we've discussed the prevalence, we've discussed why it is so severe in our country. So, what is your advice to people with any respiratory illness for this festive season and the coming winter?
Yeah. I think firstly, each and every individual must take the responsibility that air pollution, he is also responsible to some part of air pollution being there.
True.
Because what all of us do, this is not our cup of tea. It is the responsibility of government. It should be doing something for that. But they can just bring in legislations. It is the people who have to follow them judiciously till the time. Maybe electric vehicles which are coming will reduce the pollution in some time, but at least what things we can do is to reduce the pollution is, if we are traveling, if 4 people are traveling from one house, they should not be traveling in different cars. Carpooling is a technique, so that as much as automobile pollution which we can reduce, switching over to greener fuels is an option. Burning firecrackers obviously must be avoided. This is not to stop your Diwali, this is to protect your coming generations from the harms of air pollution. If you are a smoker, which leads to indoor air pollution, you should stop smoking. It is beneficial to you as well as the passive smokers in your family which are there. Further, till the time all these measures take over, please wear a mask whenever you are going out. Please keep your homes well ventilated, a good amount of sunlight, so that the indoor air pollution is reduced. These are the simple measures which we need to take. And please, please, please don't burn the firecrackers.
And what can we do to strengthen our lungs specifically? Is there anything that we can do?
See, few deep breathing exercises, even yoga, and some amount of daily, even a cardio exercise is bound to help your lungs as they help your heart also. And as they increase the blood flow, so blood helps in clearing out all the contaminants which are there. Further, have a good healthy diet. It should be rich in lots of fruits and vegetables. It should be rich in green leafy vegetables, because all these have antioxidant properties which help in clearing out these toxins which are produced, because once the air pollution is there, they form some oxidative stress. This oxidative stress is the one which is damaging. So these antioxidant things, a good diet, all helps you. Avoid alcohol, avoid smoking, so that you can keep yourself healthy.
We have reached the last section of our podcast, where we will debunk the myths and answer your most common misconceptions. Dr. Nikhil, we like to do this on the podcast where we talk about common myths that are out there, and it'll be great if you could just clarify some of these for our listeners. The first is that masks aren't safe for people with lung disease.
They are absolutely safe for the people who have lung disease. In fact, they are the protective mechanism for them, because if they already have a lung disease, they are exposed to these harms of air pollution. Even if they are exposed to COVID, they are bound to have serious impact.
Why quit smoking if you've been diagnosed with any sort of lung disease? Because the damage is done.
See, if the damage is being done, but if you still continue to smoke, the damage will keep on increasing. So first thing you have, if you want to hold on to your lungs and protect them from further damage, first thing to do is quit smoking. Almost 50% of the thing is taken care by quitting smoking. Rest will be the medications. But if you don't smoke, the disease will continue to progress and you will land up in trouble.
And if you have COPD, you can't exercise.
That's not true. We have pulmonary rehabilitation programs there, because a proper training, if done, your exercise capacity is bound to increase. Your symptomatic improvement is seen. So that's why our rehabilitation programs have been started all over, and you can exercise definitely under the guidance of your consulting doctor, who can guide you how much load you can take, but gradually you can build it up and you will feel much better and much more energetic with that.
Exposure to some level of pollutants is good to strengthen the lungs.
That's an absolutely wrong statement to be made. Any amount of exposure to pollutants are going to harm your lungs, come what may. And please, please, please don't start taking the smoke inside. That's not going to help.
There are some
you
people who
anytime.
actually advocate deep breathing in the
Yeah.
open air during winter. So
Yes.
you would say that's a total no-no.
No.
And medicines for asthma habit forming.
This problem, I think, originates long back. I think it is 20 to 25 years old myth which has been there, but it is due to the fact, mainly fact, at that point of time, we usually never had good amount of medication for asthma. Even for inhalers, people feel that it is an habit forming thing and you will become dependent on that. Inhalers have only been made because they are a safe drug delivery system by which the drug goes through inhalation directly where it is required, and it is not going into any part of your lung, which makes it much more safer. That's why in the inhalers, the drug which is given is in micrograms. The tablets which you take is usually in milligrams. So it is 1000 times less medicine because it goes directly where it is required. So there are no side effects. So it is actually a safer form of medication. There are no side effects. So please, asthma controlling drugs are not at all habit forming.
Last question or last myth is alternate medicine helps in treating respiratory diseases.
See, if your lungs are damaged, if you are not starting medications on time, then you are going to make more harm rather than benefit. Alternative medicines, I would say, if you are planning to do yoga, you're planning to do some exercises, physiotherapy training, that forms an additional part along with the medications which we give. But apart from that, there are no other medications to help your lungs.
So, Dr. Nikhil, as we sign off, the podcast is called The Prescription. What is your prescription for everybody who's listening out there for the winter and for the Diwali season to keep themselves and their lungs healthy?
So I would like to end with the fact that obviously the winters are coming, the pollution is going to get worse. Please celebrate your Diwali beautifully without the crackers. Make it safe for your coming generation, make it safe for your current generation, and also please don't forget to wear mask when you are going out. Thanks a lot.
Thank you, Dr. Modi, for coming on this podcast and enlightening us.
My pleasure.
That was Dr. Nikhil Modi from Indraprastha Apollo Hospitals who joined us for this edition of The Prescription. Do encourage your friends and family to listen to our podcast on Earshot.in or the Earshot app. It helps our tribe grow. Till the next episode, stay happy and healthy.
Indraprastha Apollo Hospitals presents The Prescription in association with Earshot.in.
Earshot, here and now.